Hi, my name is Dr. Jane Hendricks, and I want to speak to you a few minutes on the type of genetic testing I do. There are a lot of companies that have come out, software companies, to interpret your DNA. This one has to do with more functional pathways in your body, meaning functional pathways that have to do with detoxification, immune system, clearing out metabolic byproducts that, if they're not cleared out, could cause an increase in oxidative stress, aka aging, inflammation, pain. So if you suffer from a chronic medical condition like autoimmune disease or ulcerative colitis or Crohn's that's being managed for pain control and inflammation, because conventional medicine is great at managing diseases and medical conditions. However, the focus of naturopathic physicians is to get to the cause of disease. And so we do use specialty labs. One of them, for me, being this salivary DNA testing. It goes really deep inside into many different pathways. So you can see how comprehensive the report is going to be just by looking at all of these pathways that this software program is going to interpret for you. Especially now, more than ever, given the environment of health and COVID-19 and all of that, people, I think, are starting to question how their disease is being managed, because when it's being managed by pain meds, anti-inflammatories, and worst of all, immunosuppressants, things that suppress the immune system, like if you have an autoimmune condition, is putting you at a very high risk for some severe complications should you get an infection. So now more than ever, I'm calling out to patients, hey, let's look to the cause of your medical condition, which will be unique to every patient. So because guess what? We're not going to treat the clinical symptoms. We're going to treat the cause. So when we get this comprehensive report back, we can see, wow, look at this pathway. It's not working too well. And what's really great about this software program, because it goes along with naturopathic medicine in that we do not just treat labs, we treat the patient as well, is that they have a symptom survey that you, the patient, will fill out, rating your symptoms severity-wise from 1 to 3. That is included in the report. Another clinical avenue that they include is a urine test. Great Plains Laboratory is a very cutting-edge lab in Kansas City, and what they have is an organic acid 24-hour urine test. And when you do that test and pair it up with this genetic test, which takes those markers and puts it into the report, we can really see, when we're looking at these pathways, wow, clinically you're saying you have symptoms of it, and this metabolic byproduct is actually showing up in the urine test. We need to pay attention to this pathway and look at treating it with some supplements. There is a line of supplements that go with this software program. So for instance, an example, ammonia, let's say. We were looking at the urea cycle, and we see the pathway, the different pathways, it could be 10 different pathways just for the urea cycle, shows that you're sluggish with clearing ammonia. We see that you have like 3 symptoms of it. We see in the urine test that you have some byproducts of pneumonia. We're going to treat it with a supplement called ammonia scavenger. So that's just one little picture, one little section of the report that gives you an example of how we look at the clinical presentation from what you say, what's in your urine, and then what the SNP or the genetic mistake is showing on the genetic report itself. And then complementing supporting these pathways to function better. And then, of course, with every patient, I include anti-inflammatory guidelines, a way of eating, working at intermittent fasting, guiding you on that, which just goes great with the supplements. And so once we can, manage or treat the cause, you don't have to manage your symptoms anymore. This will bring longevity to your life and a wonderful quality of life, better sleep, more stamina, better moods. This actually takes into account neurotransmitter pathways as well. So I encourage you now more than ever to explore into why you have the chronic medical condition and chronic symptoms that you have, and no longer just treat the symptoms, but go deeper inside to see why you have those symptoms. And naturopathic medicine is the way to go for this. If you have any questions about the genetic testing, I do offer a 10-minute complimentary consultation. You can fill out the appointment request online on my website, or just call the office number and schedule that 10-minute complimentary consultation. Or if you're just ready to go, then we would schedule an initial visit so I can gather some medical history, any labs that you've had done recently, and then we'll get that DNA test, the salivary DNA test, sent off to your home. So you just do it out of your home, ship it straight to the lab, and in about 3 weeks I will get the results and we'll go over that together, whether it be Zoom video or in person. And you will learn more than you could ever know about your own body and your health. Thank you, and I hope to be working with you soon.